Hello guys, this is the Elite Medical Imaging Tips here again. If this is your first time, please do us a favor on subscribing to our channel and please share for others too. Also subscribe. So on today's episode, we're looking at chest X-ray PA technique. Now, what is the PA technique of the chest X-ray? It is an imaging of the chest area of the human body to evaluate the lungs, the heart, and the surrounding structure like the ribs. It is used to look at the pathologies of the lungs and the heart. So today we're focusing on the PA technique. PA means Postero-Anterior. That is the imaging of the body from the back. It's a process whereby the X-ray beam passes through the back to the front. So now let's look at the preparation. Now, when the patient comes in with the request form for chest X-ray PA technique, the first thing as a technologist or as a professional, what you do is to explain the procedure to the patient. Let the patient understand what he or she will be undergoing, the risks involved and the benefit. You seek the patient consent first. The next thing you do is to remove all opaque objects from the areas of interest. Opaque objects like clothing, earrings, any object at all that is opaque, that is on the area of interest, that is within the chest area and the neck region. You ask the patient to remove them. Now, after the removal of all opaque objects, the next thing is to put on the hospital gown. That's the examination gown. So the patient will put on the examination gown. Now, after the necessary preparations, the next thing you now move to patient positioning. As we know, positioning is a very important aspect of imaging, because for you to get a proper image or a proper radiograph, positioning is what will determine it. So the first thing under the patient positioning is that the patient will be in an erect position facing the image receptor. The patient will stand upright or will sit erect depending on the condition of the patient. Some patients that can't stand will sit and they will be facing the image receptor. The arms will be relaxed at the sides and placed on the hips. The shoulder will be relaxed and rolled forward to touch the bucky so that the scapula will be removed from the lungs feed. You adjust the height of the bucky so that the upper border of the image receptor will be 5 cm or 2 inches above the shoulders. You raise the chin and rest it on the bucky. So those are the things you need to take note when it comes to the patient positioning. Now let's look at the equipment. The equipment needed for the chest X-ray PA technique. You need a 35 by 43 cm, or if you want to make it in inches, that's a 14 by 17 inches cassette. And it's usually in landscaped position, but in some cases it may be portrait depending on the size of the patient. Other equipment you need is the lead protective apron. The lead apron is used to cover the gonad area to protect radiation from getting there. You also need the anatomical marker. In chest X-ray PA technique, the anatomical marker is usually placed left. Let's look at the centering point. The centering point in chest X-ray PA technique is directed to the mid-sagittal plane at the level of the T7, that is below the scapular border. The X-ray beam travels from the back, that's from the posterior, that's why it is called PA, that's posterior-anterior. travels from the back to the front, that's the anterior. Another important thing to note is that the exposure is made at head inspiration. That means you instruct the patient to breathe in. So as the patient breathes in and you tell the patient to hold the breath until you ask him or her to breathe out. So the patient will breathe in and hold his or her breath. That's when you will expose. After exposure, you cannot instruct the patient to breathe out. So that for chest X-ray PA technique. Those are the rudiments. We can look at the preparation, the patient positioning equipment, centering point, and those are the rudiments we can look at for chest X-ray PA technique. These things are very key, they are very essential when you are carrying out a chest X-ray PA technique.